Hi everyone, I'm Paige Abbott and this is your weekly recovery message. Last week I talked about being a parent in recovery, and this week I wanted to address the topic of being a parent with a child who has addiction. And when I'm talking about a child who has addiction, this can be a child of any age. You may be noticing, even with your young children, that prior to acting out with drugs or alcohol or smoking, they're using things like video games, isolation, reading, social media, technology, food, any behaviors like that or more to seek escape, reward, and relief. Likely you have addiction in your family of origin and extended family, as there is a strong genetic component to this disease. And if you are noticing signs of addiction, especially in younger children, a lot of parents do tend to fall into trying to control, fix, or manage the behavior. So at a very basic level, this may look like behavioral interventions, so taking away phones, taking away iPads, limiting screen time as a way to try and prevent this issue from getting worse. At a more emotional level, it may involve providing feedback or solutions, basically telling their children what to do in situations where the children aren't asking for feedback, they're not asking for advice, they maybe are just wanting to process and share their feelings with their parent, but again, the parent is in this mentality of needing to fix, manage, and control the behavior to the extent that it's difficult for them to just listen and watch things unfold without being an active participant in that scenario. As a parent, though, it is very important to learn appropriate boundaries and to learn how to step back and detach from some of these issues with love. That doesn't mean abandonment, that doesn't mean that you're not being a support, but it means that you need to let your child learn some of these things for themselves and come to you asking for help and asking for support without you automatically being there to provide the soft place for them to fall. As children age, parents may start to look at how can they support their children financially. So it's also important to look at financial boundaries. So if your child recognizes they have addiction and they're seeking treatment and support, then you may feel comfortable providing financial assistance for treatment, counseling, and maybe even helping out with basic necessities. If your child has addiction but is not currently engaged or willing to get help, then providing support for basic necessities can be enabling because it essentially allows them to keep active in their disease without experiencing any consequences for what's happening. So it can be very tough for parents to step back and let this process unfold. And this is why two of the key things that you can do as a parent if your child has addiction is, one, to engage in recovery yourself. So this includes abstinence from mood-altering substances, including drugs and alcohol. So that doesn't mean that you necessarily have an issue with these substances yourself, but addiction is a genetic disease. So if it's manifesting in your children, then you may be vulnerable yourself. And it's important that you establish a safe environment that's alcohol and drug-free that your child can either live in as well as visit when they're interacting with you. Overall, drugs and alcohol are things that any human being can live without. So if you're having a difficult time letting go of these substances, then you may want to look at the attachment that you have and that your brain has to these substances. But in addition to that, just looking at your own health and recovery along emotional, psychological, and spiritual dimensions is also key. So learning how to deal with feelings, learning to like yourself, learning to sit with yourself, connecting to something greater in that spiritual realm, developing hobbies and activities that you yourself enjoy, and just cultivating that relationship with yourself and other people puts you at a better position to support your loved one who's struggling, and as well to not get so enmeshed with them and wanting to fix, manage, and control something that you're inherently powerless over. Very challenging for parents in this process, and a lot of feelings will come up. And that's the second thing that I encourage all parents to do, is you need to take time to sit with your feelings and to let those feelings come up. For having a child who has addiction, there's going to be feelings of sadness, feelings of shame, grief, loss, disappointment, guilt, resentment, and the list goes on. You need to take time to let these feelings come. So taking quiet reflection time, meditation, journaling, and just daily taking time to step back and check in on how am I feeling are key ingredients to your own health, which then will allow you to support your loved one who is struggling. Hopefully, if you're not already engaged, you may need some professional support as well as community support. So you may look at community support groups like Codependence Anonymous or Al-Anon to help you establish healthy boundaries and to process your own feelings. And you may also want to consider some professional support. So finding a healthcare provider who specializes in addiction that you can process some of these issues with and continue to pursue your own recovery regardless of where your child is at. This is a big topic and I could probably keep talking, but I'll leave it at that. Pursue your own recovery, including abstinence, deal with feelings, and look at appropriate boundaries. So not getting caught up in enmeshment, enabling, or trying to fix, manage, and control. That's my perspective for this week. I wish you the best in your ongoing journey of recovery for the week, and I'll talk to you next week. Bye for now.